In a move that has stirred concern among Singaporeans, Great Eastern has suddenly suspended pre-authorization certificates for policyholders seeking treatment at Mount Elizabeth hospitals. That means, for now, if you're covered by Great Eastern's private health insurance and planning to go to Mount E, you might not be able to get a cost guarantee up front. This has raised serious questions about the state of our private healthcare system. Health Minister Ong Ye Kung didn't hold back in his response. In a Facebook post, he said private insurers and private hospitals have, in his words, tied themselves up in a knot. And the ones paying the price? Everyday Singaporeans. Let's break it down. Over the years, insurance companies in Singapore tried to attract more customers by offering what's called as-charged coverage. Basically, you claim whatever your hospital charges, no cap. On top of that, many added full riders that let patients avoid paying even a single cent from their own pocket. Sounds good, right? But here's the problem. When people don't have to pay out of their own pocket, they tend to use more medical services, sometimes even when it's not really needed. The data backs this up. Ong Ye Kung revealed that patients with full riders are 1.4 times more likely to make claims than those without. And when they do, their claims are also 1.4 times bigger. This created a huge problem for insurers. Claims kept going up, but the premiums they collected couldn't keep up. So what did the insurers do? First, they made things stricter, like only covering treatments from selected doctors or requiring pre-approvals. And now, in the case of Great Eastern, they've even stopped giving pre-authorization at certain hospitals. Second, they raised premiums. And not by a little. Some riders now cost nearly $10,000 a year. That's a huge sum for seniors and families. So it's no surprise that more and more people are dropping their riders completely. Ong Ye Kung said this spiral has left everyone unhappy. Patients are angry about rising costs. Doctors say it's harder to make claims, and insurers are struggling to stay in business. Meanwhile, more patients are now turning to public hospitals, which are already under heavy pressure. Public hospitals make up 80% of beds, but are now handling 90% of all inpatients. That's a serious imbalance. So what is the Ministry of Health doing about this? First, since 2018, they've set guidelines for how much doctors in private practice can charge. They're now also looking at setting similar benchmarks for hospital charges, not just doctor fees. Second, they're taking action against doctors who try to game the system. Some have been disciplined or even banned from using Medisave and Medishield Life. Third, they want more affordable private options like Mount Alvernia and are exploring a new not-for-profit private hospital, though that will take years to build. But Ong Ye Kung says the biggest change must come from insurers. He urged them to relook at their product design. Some are already offering cheaper plans with higher copayment, which means patients share some of the cost. These new plans are half the price of the old ones and might be more sustainable in the long run. Here's something to think about. Can we really continue with a healthcare model where nobody wants to pay, but everyone expects full coverage? And if public hospitals become overloaded, what happens to the quality and waiting time for care? Ong Ye Kung ended his post with a warning. If this knot isn't untied soon, everyone loses. But he also gave a promise. MOH will step in to help loosen that knot. If you find this interesting, don't forget to like, share, and subscribe to our channel, 2230.